attacks having a panic attack. It's called a panic attack. It's worse.
Giving a person on hospice the last dose of morphine before their death can be unnerving. I've had that feeling myself, and I am a very experienced hospice nurse. It is easy to believe and hard to think that you might have caused a person to die or even just die faster when you give them the medication and then they take their last breath. Most people who are dying on hospice do have symptoms at the end of life that need to be managed. And the drug that we most often use is morphine because it works the best. There is always going to be a last dose of morphine. Sometimes it's the first dose. That is not what's causing their death. Their disease is ultimately what will end their life. It's also important to know that people can be held here when they are suffering in pain or with other symptoms. And it isn't like they are experiencing a good quality of life. Compassionate end-of-life care means doing whatever we can to ensure that the person is comfortable so that they can let go and leave when it's their time. And it will be time. Death will happen with or without the medication, but the experience will be much better for them and for you if there is no suffering involved.